The Challenge Initiative uses a business unusual model to support local governments in poor urban areas to implement effective and lasting interventions for family planning and adolescent and youth sexual and reproductive health. In Nigeria, TCI helps local governments across 12 states to implement high-impact interventions such as the Family Planning In-Reach. A family planning in-reach provides clients mobilized from the community with family planning services at a primary healthcare center on a designated day. It is a client-centered approach that allows a client to access quality family planning services and a comprehensive package of other health services in a convenient and cost-effective manner. Providers at the facilities where in-reaches occur work closely with community social mobilizers to coordinate the timing and promotion of the in-reach for seamless service provision. Clients' turnout on in-reach days can far exceed the usual attendance observed on normal service delivery days. In-reaches have many benefits. They can help reach underserved communities with family planning services, improve contraceptive uptake, expand the method mix by strengthening capacity of providers to offer long-acting reversible contraceptive methods. And in-reaches can integrate quality contraceptive care into reproductive, maternal, newborn, child, adolescent health, and nutrition services. Here is how to conduct a successful family planning in-reach in 3 phases. The first phase is devoted to planning. In this phase, you will engage stakeholders, select primary healthcare centers for the in-reach, and identify additional service providers. To engage stakeholders, hold a planning meeting at the state level and allow a reproductive health supervisor from the relevant local government area to lead the discussion and planning for the in-reach. Agree upon criteria to be used to select the in-reach facility and then set the frequency and timing of the in-reach. Next, select the primary healthcare center by first mapping the area and noting which primary healthcare centers fit the selection criteria. Assess the site for cleanliness, safety, and privacy. Then, determine the availability of family planning commodities and consumables you will need. The last step in the planning phase is related to the team needed for the in-reach. Identify trained service providers from nearby facilities and determine their availability on the planned in-reach day. This team will support the in-reach facilities provider and the reproductive health supervisor with counseling and service provision during the in-reach. Because in-reaches can result in overwhelming turnout, make sure you have requested adequate family planning supplies and consumables from the state prior to the in-reach. To start the second stage, activate the local government area health educator and train social mobilization teams 3 to 5 days before the in-reach to conduct door-to-door sensitization campaigns to create and sustain awareness and mobilize potential clients to the facility where the in-reach will be held. At the facility level, generate demand for the in-reach by providing family planning information and referrals to women and girls coming for other services such as immunization or antenatal or postnatal care. At the community level, sensitize community members about family planning as community dialogues for other health topics such as malaria or nutrition and refer them to the selected health facility for the upcoming in-reach. You will conduct your in-reach on the appointed day in phase 3. On the day of the in-reach, first hold group counseling sessions for potential clients. Clients then go for individual counseling. This is where a service provider discusses all method options while guiding the client in choosing the method best suited to her needs. She will then get a pregnancy test. If the client chooses a long-acting reversible contraceptive method, she will go to a private area for service provision. Following the procedure, the client will receive detailed post-procedure instructions and backup contraception if needed. She will also be scheduled for a follow-up visit. Collect and record data of clients that access family planning services during the in-reach in the Facility Family Planning Register. Also, report the family planning data to the local government area. Keep the following lessons in mind when conducting an in-reach. Demand for family planning services can be overwhelming, so stock up on commodities and consumables. Women are more likely to take up a method after hearing a satisfied client share her experience. In-reaches can expand method choice, especially in health facilities without trained long-acting reversible contraceptive service providers. Advocacy and demand generation efforts have the potential to increase support and community awareness, paving the way for rapid uptake of family planning at in-reach service delivery points. In-reaches can meet the growing needs for family planning of underserved populations and poor couples of childbearing age, including marginalized and vulnerable groups. Social mobilization activities prior to an in-reach can increase number of completed referrals being recorded for the community. Following a successful in-reach, a meeting should be held to discuss lessons learned during the exercise. These lessons will be applied to subsequent in-reaches. To sustain implementation of the in-reach, state and local government area family planning coordinators should include in-reaches in their annual plans to ensure that they are budgeted for and executed. Find out more about TCI's family planning in-reach approach in TCI University. Visit the TCI website, click on TCI University, then Hub Toolkits. You will find this approach in the Nigeria Toolkit under Services and Supply. TCI thanks all of its local government partners and stakeholders in Nigeria working to improve the lives of women and girls in urban slums. For more information about other TCI high-impact interventions, visit tciurbanhealth.org or talk to your state TCI focal person.